When prepping the abdomen for cesarean birth, place surgical towels under each side of the abdomen and in between legs to absorb excess solution. Next, you will open 4 Chloraprep packages and place on the designated prep stand. For high BMI patients, you will need 4 big wands. Otherwise, open 2 large and 2 small wands. Don your gloves. Grab the first large Chloraprep. Hold the applicator with the sponge down. Do not touch the sponge. Pinch the lever only once to activate the ampoule and release the antiseptic. Do not shake the applicator. Allow the solution to partially load in the sponge. Press the first cotton swab against the sponge and clean the umbilicus, then discard. Repeat this step with the second cotton swab and then discard that swab. Gently press the applicator against the treatment area to evenly distribute the solution throughout the sponge. Once the solution is visible in the sponge, use gentle repeated back and forth strokes over the site for the incision. Do not press hard, which will release too much Chloraprep, causing pooling. Scrub the incision site for 30 seconds. If the pannus is covering the incision when sitting or standing, scrub the incision site for 2 minutes. Even if the pannus is lifted by the retractors, the longer scrub is required. Do not get the retractor straps wet with the Chloraprep. Progress from the incision to the fundus using small back and forth motions. Next, we will scrub the sides of the abdomen. This is where you will switch to the smaller wands on a non-obese abdomen. Wand 2 is to be used from where the Chloraprep ends in the center, scrubbing down the sides to right above the towel. For wand 3, go to the opposite side of the patient and scrub that side of the abdomen, starting at the center and progress down to right above, but not touching the towel. Grab the last large wand and start at the top of the mons pubis and prep both upper thighs and groin. The last scrub action proceeds downwards from the mons pubis towards the inner thighs. Then discard the applicator. Blot the wet hair prior to removing the towel. Allow the solution to completely dry for a minimum of 3 minutes. If any contamination is suspected, start the surgical prep over from the beginning. Remove all the towels, ensuring not to contaminate the prep area before draping. Let's review some key points about the abdomen scrub with Chloraprep. All patients require 4 wands. If the patient is obese, use 4 large wands. The rest of the patients can have 2 large and 2 small wands. Scrub the incision site for 2 minutes if the patient has a pannus. Avoid applying Chloraprep intravaginally or to the labia. Thank you for taking the time to view this video. Applying what you learned here will help decrease the risk of surgical site infections for your patients.